The moment we say cosmetic surgery, the person that comes to your mind immediately would be Michael Jackson.
It is not just about beauty.
So what is the percentage of women really coming now? Do you see that
Like neck pain, back pain, and shoulder pain.
the moment we say cosmetic surgery, the person that comes to your mind immediately would be Michael Jackson, for he went under the knife several times to look the way he looked. Cosmetic surgery is not just about beauty and looks, says Dr. Preetha Rani, cosmetic and plastic surgeon at the Royal Care Hospital. There are several other issues that cosmetic surgery could redress, and that includes flat chest and enlarged breasts among women, which lower their self-confidence and self-esteem to a great extent. Let us listen to her to check out how these kind of surgeries could be a morale boost to the women who come up with issues of disproportionate body structure. Let's listen in. Hello, doctor.
Yeah. Hello.
So, doctor, there is always this notion that plastic surgery and cosmetic surgery is mostly about perfection and looking beautiful. Is that really a misconception? Do women really come with problems, issues that require plastic and cosmetic surgeries?
Misconception that cosmetic surgery is done to a normal people, which it is only done only for beauty. But there is a lot of awareness to be created among women regarding the breast surgeries.
Okay.
Breast health awareness, I would like to say. It is not just about beauty. A lot of women need help from us. That is because lot of women are shy, or they have inhibitions to come forward and to seek solutions for problems regarding their breast. They are shy to speak about the breast problems. It is important we create this breast health awareness. It is important to consider breast as a organ of our body, very much like the heart or the liver, because it plays an important role in defining gender and body image. Women who come and seek consultation for breast problem, they are either shy or they feel they to come forward and to ask solutions for problem regarding their breast. We face women with two kind of issues. One, women with very large breasts disproportionate to their body size. We call it as macromastia. In common terms, it is like women who have disproportionately large breasts, and these women are psychologically affected because of that.
The reason is not obesity.
The reason is not obesity.
Okay.
Even in normal individuals who are not obese, they have slightly disproportionate larger breasts. And breast, if you see, when a girl attains puberty, from that time the breast starts developing through pregnancy, and when she starts breastfeeding, so that time the breasts start enlarge. And for women who have disproportionately larger breasts, because of this, they have certain problems or symptoms which we call like neck pain, back pain, and shoulder pain, or bra strap pain, and they might have rashes below the breast. So when they go out, they find it difficult to buy clothes that are convenient for them or that suit them, or even brassiere that supports them. So these women should come forward and seek treatment.
So what is the percentage of women really coming now? Do you see that not many are coming forward?
Compared to the West, in India, especially in Tamil Nadu, the number of people who come forward and seek help is very less.
Okay, so doctor, this is both in the case of enlarged breasts, also in case of very small ones,
Yeah,
and also I think there are cases of women who have breasts one of each shape. I think you have cases like that also, right? What is the reason, and
yeah.
how do you address it?
It is very normal. Both the breasts are never of the same size. Mild disproportion is common.
Okay.
But for women who have greater disproportion between both the breast size, we do have solution depending on the need, what the woman asks, and what is appropriate for their body type. That is what we would like to provide them.
Okay. So when it comes to breast augmentation, is it the silicone procedure, doctor? Because we have read a lot of negatives about silicone implants, that it has a lot of side effects. There are several other complications that develop post procedure. So, is there something new that has come up now, or could you explain what it is?
Yeah. So breast augmentation is what we do for women who have smaller breasts, and disproportionately they are small when compared to their body size. So they feel shy, or because if they have a flat chest, their confidence levels are low. We wait until a certain age beyond puberty when the breast starts growing in size, and then once they've reached become an adult, we offer them. Two types of surgeries are available. One is breast implants, and the other using autologous tissue, which we call breast augmentation by autologous tissue.
Okay.
That is, we use fat grafting.
Okay.
That is using liposuction. What we do is through liposuction,
you remove fat.
We remove fat from the areas in the body where there is excess fat.
Okay.
That's purified and injected by a small hole, pinhole surgery we would like to term, into the breast.
Okay.
So each sitting, each breast around 150 to 200 cc of fat can be injected. This might require more than one surgery, depending on the body habitus of the individual, how much fat reserve she has, and her expectations. But it does not have the side effects of the implants.
Silicone
implants.
Okay.
But I will also like to add, silicone implants, the latest US FDA approved silicone implants, they are of very good textured implants of anatomical shape, and they give a very natural feel to the breast. And the earlier complications we had with the implants are hardly found nowadays.
Okay. Doc, nowadays women are criticized for not breastfeeding post pregnancy. And the issue that they have when it comes to breastfeeding is that the breasts would start sagging and they would lose shape. I understand that there is something called mommy makeover, wherein you bring back a mom to her original shape or pre-pregnancy shape.
Yeah.
So could you tell us about it?
Yeah. Women undergo a lot of changes through pregnancy. 9 months of her pregnancy, and her abdomen gains weight,
starts
stretching. The skin over the abdomen gets stretched.
Yes.
Skin develops stretch marks, and as she gains weight, there is fat deposit between the skin and the muscle underneath. The abdominal muscles, as the abdomen increases in size, they tend to separate and stretched out, and sometimes it forms a gap in the midline. We call that as a rectus divarication. In simple terms, it's a split of the muscles in the midline. So after delivery, and when they lose their excess weight in the first 6 months and they want to get back into their shape, the tone of the abdominal muscle is lost. In spite of exercise, they'll not get their tone which was present in the pre-pregnancy period. And because the skin is all stretched out, the skin hangs in the lower abdomen. And the muscle tone is reduced. So the breasts enlarge in size during pregnancy, and when she breastfeeds during lactation, the breasts enlarge in size. Post lactation period, the volume tends to come down. So the excess skin, the breast which has stretched, now starts to sag. So they have this sagging breast and the lower abdomen skin is hanging. So in spite of exercise or losing weight, they will not be able to get back to
the
their
original
pre-pregnancy
form.
look. So in mommy makeover, we actually do a breast lift and a tummy tuck.
Okay. And doctor, can you explain to us the duration of hospitalization? How long would it take? What should the patient do afterwards to ensure that doesn't get to the previous form, not putting on weight? Because the most important thing when it comes to cosmetic surgery is maintenance. You have to maintain it the way it is. Otherwise, it is just a reversal of whatever you have done. So what does one need to do, and what is the kind of hospitalization that this warrants?
For a mommy makeover, when we do a breast lift, post-op for around 2 weeks, the patient is required to wear supportive braces.
What is the hospitalization duration, doc?
Hospitalization for a mommy makeover will be around 3 to 4 days.
3 to 4 days. Okay.
Yeah. And then after discharge, she's supposed to take care of herself, avoid lifting heavy weight,
Okay.
post a tummy tuck. Because in the tummy tuck, what we do is we remove the excess skin,
Fat.
the excess skin and the excess fat, we remove it by liposuction along with abdominoplasty. So we
Okay.
call it as lipoabdominoplasty.
Okay.
So, and what we do, the muscles which have been separated out, we stitch them in the midline.
Okay.
And these women who had multiple pregnancies, their umbilicus is also slightly displaced.
Okay.
It becomes lower. So we restore the umbilicus to its normal
Original
position.
space.
We
Okay.
call it umbilical translocation. So post a mommy makeover, she'll have to take precautions, avoid bending or avoid lifting heavy weight for a minimum of 6 to 8 weeks. And post 8 weeks, she can resume her normal activities.
Okay. And how about breast augmentation? What is the hospital stay that is required, and what should she do after?
Yeah, breast augmentation hospital stay will be around 2 to 3 days. Post procedure, she can resume to her normal household activities in around 2 weeks time.
2 weeks.
She'll have to wear proper supportive braces all the time. It is important to note that women who come forward for liposuction, they should be really motivated. Those women who are obese and who have lost weight, only those people we offer liposuction. Liposuction is not the solution to losing weight.
Right.
For women who are motivated by doing exercises, who tone their muscles and they want to get back to their original shape, there are certain areas in the body which has resistant fat. We call it as stubborn fat.
Okay.
In spite of doing exercise or following diet loss,
you will not be able to
lose, get rid of the stubborn fat.
Right.
These are the areas which we address by doing liposuction.
So doctor, beauty is not about women. How does it help in men?
A lot of men come forward for liposuction. We term it as body sculpturing or body contouring. That is, men who've been obese and they need to be extremely motivated, follow diet and exercise, lose extra fat, and liposuction we offer to get rid of the stubborn fat.
Okay.
Stubborn fat occurs in the areas like in the chest, lower abdomen, and in the hips. Few men, in spite of exercise, they'll have disproportionately larger breasts and they are shy to come out.
Right.
So these individuals, we do a thorough workup including their hormonal examinations, and when they are completely normal, what we offer them is liposuction to decrease the excess fat in the chest.
Okay. Thank you so much for talking to Covai Post,
Yeah.
Doctor. Thank you.
Thank you.